Yes. So, hello and welcome to Seven Sentinels. This is Grandmaster class. Yep. Hello and welcome to Seven Sentinels. This is Grandmaster class, and I'm Peter Simon with you. Today I'm conducting a speaking session. Here we have a nurse with us, originally from Ghana, currently residing in the United Kingdom, and she's preparing for her nursing specific occupational English test. Yes, Matilda, once you are ready, you can start. If you have anything to ask before you commence this test, you can ask me now.
No, I have nothing to ask.
Yes, then you can go ahead.
Hello, good morning.
Good morning, nurse.
Um, my name is Matilda. I'm one of the nurses here in the clinic. Can you please confirm your name for me?
Yeah, my name is Lincoln, Abraham Lincoln, and you can call me Mr. Lincoln. I am 60 years old.
Okay, Mr. Lincoln. Nice to meet you. I understand you've come to the clinic for your insulin injections. Is that right?
You're absolutely right, nurse. And the doctor asked me to meet you to discuss regarding self-injecting insulin. I don't know what is wrong with this doctor. 3 days back, there was a blood test, and I think he got the reports and told me. So I'm worried, nurse.
I'm so sorry about that. And so many people have this feeling when they are commencing insulin injections, and how you're feeling, it's also very normal. People have fear of the pains and the needles, and I understand you perfectly well.
You're absolutely right, nurse. I am a bit anxious, not a bit, more than, more anxious, I can say, and I'm unsure about starting insulin injections. I have been managing my diabetes excellently till now with my diabetes diet, exercise regimen, and the medication program. So I think it was working very nicely until yesterday, but now I am little bit perplexed. I don't know what to do. Tell me, nurse, tell me everything.
Um, I want to reassure you that insulin self-administration of insulin, it's very, very easy. And it's because you've not done it before, that's why you're having this anxiety. And what I will tell you is I'm going to teach you every step of the way how to self-administer, and you will see that what I'm trying to say,
That's
it's a
really
very
fine,
simple
nurse. That's
procedure to
really
do.
fine. That's really fun. But I just don't really like the thought of injecting myself. I don't think I'll be able to do it.
Oh, you know, insulin injections are faster as compared to the oral medication, because that goes through an injection process, a digestion process. But insulin injection goes straight to your bloodstream, and this also makes it very effective and manageable. So I think it's the best option. That is how to.
Yeah. Is there any other way to manage my diabetes, nurse, other than these insulin injections?
Yes, there are other ways that which you're already doing, which is the administration of tablets, which you're already doing, and managing with your diet, and it's not helping. It's not making the blood sugar go down. So the doctor thinks we should start the insulin injection, which is the best option for you.
Okay, I understand, nurse. All of that information is very clear now. I understand the importance. Yeah, come on, go ahead and explain me everything regarding this insulin injection, self-injecting.
So if you understand, I can go through the main process. That's
Yes, please
how
tell
you
me,
go about
nurse.
it. Okay. So before you start an insulin injection, you need to make sure your hands are clean. So you wash your hands and dry them. And then you paint your skin where you're going to inject the needle. You paint your skin. You insert the needle 45 to 90 degrees angle, and then you leave it in place for 5 to 10 seconds. Usually people start to count from 1 to 10. So you can start counting from 1 to 10. And when you reach 10, you take the needle out of the skin. Do you understand me?
Yeah, of course, nurse. And what about the sites where I have to take the injections? Where exactly I have to take? Should I take the in the same location every day, or should I change the locations of injection sites?
No, you need to be rotating the injection site. This will help prevent formation of lumps and the risk of less insulin absorptions. So you need to be rotating the injection site.
That's very fine, nurse. And what about the syringes and needles? Should I use the same
Yes,
ones, or should I modify, take a new one every day?
proper disposal of your needles is very, very important. And you need to handle your sharps and needles with caution to prevent injuries. So you need to put the needles in a well-fitted container or a cardboard paper so that it prevents you from further injuries. And also with the insulin storage, you need to keep the unopened insulins in a refrigerator, and you keep them away from sunlight and high temperatures. You need to also make sure you are checking the expiring date of your insulins.
Okay, nurse. What should I do once the disposable container is filled?
What you have to do is you call any the district nurses, or you ring the hospital, and we'll come and get the sharp box and give you another container.
Okay, is there any brochure or leaflet that I can have with me so that I can go through these points in
That's
detail?
that's fine. If you need a leaflet, we're going to give you a leaflet on how to go about everything. But we are going to demonstrate together how you're going to go about all this process, so you don't need to worry about anything.
Yes, nurse, I feel better about the injections now. I'm ready for you, nurse. You can watch me give myself an injection as you have.
Okay.
If there is anything going wrong, please guide me. And I hope there will not be any side effects or any problems related to this one.
I promise you there won't be any side effect. Very safe and effective. So I'll go and gather my things, and I'll come and demonstrate together with you how to self-administer insulin. Is that
Thank you.
okay?
Thank you very much. That's really wonderful. Thank you once again.
Thank you.
So, I'll give you a detailed feedback to you in
Okay.
a typed format. I'll give you a
Okay.
detailed feedback in a typed format, in tabular format, what type of mistakes you are doing, what are your
Okay.
problems, what are your weak areas. So
Okay.
you need not worry about anything. You are going to get all the ideas. What are your problems actually, and your pronunciation is very good. No doubt regarding that. Your pronunciation is good, and you have been in the UK for quite some time, so you are getting adapted there to the pronunciation patterns there. You're doing well, and the flow is very excellent. The vocabulary you are using is also fine. The accent is a little bit better, and then comparatively compared to others. And I think you have the subject knowledge very much, so you are using all that knowledge, and you are properly passing on the information required by the person who is in front of you. That means you are meeting the requirements. And then the grammar, okay, grammar is very good, 80 to 85%. It's absolutely fine. But the thing is, it is correct only, but improvement is needed. For example, you are saying active voice more, so avoid active voice. You can say like um, the demonstration. Okay, I will give you a demonstration. The demonstration will be given like that one. Passive voice is better. I will teach you. I will tell you. I will give you a brochure. A brochure. Here are brochures. They will be provided. The brochures will be provided, and excellent knowledge regarding insulin injections, self-injecting insulin injections can be obtained from these brochures. So like this one. So you can read, I will give you this, I, we, you, he, she, it all avoid as far as possible. So passive voice is very important. The person who is receiving the action or the subject which you are going to talk about in that particular sentence is very, very important. So focus on passive voice, which will strengthen or which will enhance the quality of your speaking session. Anybody can say, I will explain you. For example, if you say, I will explain you how to self inject insulin, is it anything great that you are doing? No, you are doing the job which any other nurse in the world can do. That's it. Even a new nurse who is 1 week experienced, she also can explain self injecting. So, what is your greatness? Because you are saying, I will teach you. Are you the only one person in the world who can teach? There are many other people who can teach. So what is your special? Then why are you beating your own band, self, self buttering? That means giving you special importance. I will teach you. No, the explanation will be provided. The information will be given. Okay, the injection insulin should be drawn. So you draw insulin. No, insulin should be drawn from the vial. So the area should be cleaned. You clean the area. No, the area should be passive voice as far as possible. Try. You will get from B grade. You will get A grade. So this is B grade. You got clear marks. It will be something around 370. So you are doing very fine. But the quality you have to improve. So you are definitely you know eligible. You're qualified. You deserve B plus. That means 400 and above. And if you work a little harder, you can get 450 also. That is A grade. There is no doubt regarding that. You can definitely excel. Now, do you have anything to ask? You can ask me now.
No, sir. That's fine. So
So
I'll be
you,
waiting for the feedback.
yeah, this is oral feedback I gave. I'll give you a written feedback, and you can go through that one and you can improve on it a little bit. How did you feel this session? Were you happy? Were you
Yeah, it was
nervous?
very helpful. When you're going to start, you feel a little anxious and tensed, but as you speak, you get used to.
So fine, that's very good. Now what you can do is now you can take the second card and prepare yourself because you said today is a holiday. You can take more sessions. So maybe after 1 or 2 hours you can do another speaking session. But before that one, study, research, plan, learn how different people have talk spoken different sentences. Second card is ask my attack. So you can go to my website, check the browser there. There are many people who have spoken asthma. Okay, so you have my YouTube. I think I will give you your YouTube link. In the same thing, you subscribe, and then there same in my channel you search. Otherwise, you tell me, give me some samples of your YouTube videos. Then I will send you the samples. You can prepare those things, and afterwards be ready. Maybe after 2 hours or that after some time, you can definitely do another speaking session. But your next session should be even far more better than this particular session. Is that okay?